Well, let's go ahead and get started. Vince, I'm going to have you give the credentials. I know that you're a licensed insurance broker or whatever, and so we're really grateful to have him come and talk to us about this important issue. Thank you.
Should I use the microphone for the? Yeah, that's what I thought. Yeah. Very good. Oh, one. That's good. Maybe more will come. All right. Good morning, everybody. I've been here many years, every year this time, and this is a good time of year because it's the Medicare open enrollment season. So it's where people can make changes if they want. It's largely overblown, and very much so. You know, there's loads of advertisements out there because all these insurance companies, they want to get your business, basically. But there's all sorts of reasons you can make changes throughout the year. It's not just about open enrollment. So that's one thing I want to point out. And I've been doing this since 1986. I was really young back then. I was worked for FHP. It used to be the first HMO plan when they first came out. It's not around anymore. It got acquired by United Healthcare. Then eventually I worked for insurance companies, and then I went out on my own as an independent agent in 2007 because companies started using independent agents. And it's been really great because I don't report to anybody. It's my own business, and I can do all the different plans that are out there except Kaiser. Kaiser is their own sales agents. But I know about Kaiser, and I can compare Kaiser if people want to know. So it's a fun business to be in because I feel like I'm a teacher because there are a lot of details with this. And at the same time, I get paid from insurance companies. People don't pay extra going through me. So we're going to go over this one-page sheet. This is what I bring and I use all the time it's like a roadmap explaining what everything is. So it all starts up on the top left side, original Medicare, A and B. It's interesting, like just the other day, I had a man going to be 65 in February, and I forget how little they know. Because I start from scratch. Now there's part A and part B, and already they're confused. Well, what's A? What is B? What does that mean? They get them confused. People on Medicare tend to know after a while. It's that red, white, and blue card. Part A is zero cost. That's why I put a zero there. And that's because people paid into taxes for at least 10 years, or their spouse did. Part B, like boy, that's the medical part. That's everything outside of the hospital, x-rays, doctor visits, outpatient services. So you see, I already filled this in for next year, 2024. That's why this is 2024 costs. $174.70. It was just announced a few weeks ago. That's what's going to be next year's Part B premium. Now that's the standard premium. Some of you, if you've been on Medicare, you know you pay more maybe. There's more and more people paying more than the standard premium because of income. The government always looks back on a rolling 2-year look back. So this year, they're looking back on 2021. And then you're going to all get letters in December. They sent it out first part of December explaining what 2024 is going to be like because they're going to look at 2022. So it depends if you file the taxes jointly or individually. If you're a high income earner, you know, because you pay more and you get the letter. It's pretty high. For an individual, they keep bumping up a little higher every year. Next year, it's $103,000 for an individual and $203,000 for a couple. So if you're below that, then you'll pay the standard fee. So that $174.70 is increasing by only $10. It's $164 right now. You won't notice it at all because there is going to be a 3.2% increase in your for COLA, cost of living adjustment. So they're estimating, depending upon your check, you should be getting maybe $50, $60 more a month because of that 3.2% increase. But it's going to minus $10 because they're increasing the Part B. Oh, no, this $174.70 is every month. It comes out of your Social Security check, right? That's another thing. A lot of people don't realize that because it just comes out automatically out of your Social Security check. Or you may remember when you first went on Medicare like 8 years ago, it wasn't $174, it was more like probably $120, $110. Way back in 1986 when I started, it was $15. Isn't that something? So it really increased. So that typically goes up every year by a little bit. So see, original Medicare, see where I say it's similar to a PPO? Because original Medicare is better than any PPO that I'm going to get into, because that PPO term for Medicare is relatively a new term for Medicare. Well, original Medicare has no networks. PPO means preferred provider organization. Take the pen here. And preferred provider organization means there's in-network doctors and out-of-network doctors where you pay a little bit more. But I'm going to get into that when we go on to the other side. So this original Medicare side, I would call it the traditional side. When Medicare first started, that's what it was. Original Medicare, they didn't have the other side, the Medicare Advantage. We'll talk about that next. So with original Medicare, there's a Part A copayment that I have on here. That means if you go to the hospital, every time you go in the hospital for next year, you're going to have to pay $1,632. That's why most people don't just have Medicare. They have a supplement or Advantage, or maybe you have an employer group retirement plan. It's very rare when people just have Medicare because they don't want to pay $1,032 every time we go in the hospital. And for Part B, there's a deductible, $240. So that's not bad. A deductible of only $240. And after you make that, reach that, then you pay 20%. Once again, that's why people don't just have Medicare. Although 20% of Medicare isn't so bad, but the problem is how I put over here, no max out of pocket. There is no ceiling to that 20%. So the government doesn't give you protection of the 20%. Once again, that's why people don't just have Medicare. There are some cases where people do, like veterans. If someone's a veteran and they always go to the VA hospital and they're confident they're never going to go to any other place but the VA, they might not want to have Part B. They'll tell the government, don't take that out of my Social Security check. I have veterans. Or if someone's 65 and older, because you go on Medicare when you're 65, but not if you're still working, not if you still are working under an employer group health plan or your spouse is. Typically, the employer group health plan is going to be not as expensive. It won't be $174.70 generally out of the paycheck once a month. So people over 65 do not have to go on Medicare. That's a very confusing issue, because when someone's turning 65, they'll say, and they're working and they're planning on working still, well, my friend told me I have to go on Medicare or I have to get A. You don't have to. So I show them where it says you do not need to do that. And in the Medicare New Handbook, if you're on Medicare, every October they send out a Medicare New Handbook. It's a very thick book with a lot of details in it. And usually nobody ever reads it. There should be a class just for that. Well, there you go, right. Well, this sort of sums it up. You're right. Okay, so that's A and B of Medicare. And it's not a PPO, it's Medicare. It covers every doctor and hospital in the United States, wherever you want to go, and it covers it exactly the same. Medicare pays 80% and you pay 20% unless you have a supplement. And Medicare doesn't cover out of the United States. That's sort of good to know. But once again, the other insurances will give you out of the country emergency travel. So then we go to the second box, Part D. That's easy to know. Part D stands for drugs. And so there are 23 plans, drug plans. These are called standalone drug plans. Now, it's interesting because already there's been an update. There was 23 plans 2 weeks ago, but the government sanctioned one very small company. It was a Part D plan called Clear Springs. If anybody's on Clear Springs, you're going to get a letter because they can't terminate the contract with them. I don't know the details. They were administratively not doing something right. So now there's 22 plans. And out of the 22 plans, there's probably 3 or 4 that consistently come up to the top of the most cost savings. How I help people with this, or how anybody can do this, on Medicare's website at the bottom here, medicare.gov. Medicare.gov. You go on that website and you click Plan Finder. And that's how you can narrow down all those drug plans, because you put your drugs in there and it will bring up to the top the most cost-effective plan for the year based upon your drugs. You can't really say, well, I don't know what I'm going to get in the future, and I'm going to put all these drugs in. That's not a good idea, because you should base it upon what prescriptions you're taking now, because all the drug plans will cover a drug in the future. They all cover prescriptions. Sometimes they may need prior authorization if it's a really expensive drug. So the big news on this one, WellCare is a very popular company for drug plans. WellCare. Right now, it's $8.30 a month premium. Now, it has over a $500 deductible for brand names, not generics. So if someone's taking generics, that's a great plan. It's $8.30 this year, but believe it or not, it's going to be 40 cents a month next year. It's kind of ridiculous, but good for the people. 40 cents a month is your premium for a drug plan. But once again, if you're taking brand names like Eliquis, Xarelto, those are very expensive cardiology drugs, or Jardiance, or Ozempic, that big commercial with Ozempic for lowering A1C. This 40-cent plan will kick in. It'll cover those drugs, but you're going to have to pay $545 annual deductible. You're going to pay, so on the first January, picking up your Xarelto, you're paying nearly $600 because of that $545 deductible. But then after that, you're good. Now, if somebody doesn't want that deductible, they could go with an $82.60 drug plan. That's one with no deductible. But when you do the math, it often doesn't make sense. But sometimes people don't like that big hit in the beginning of the year. So they'd rather have consistency. So they'll go on the $82 plan. And there's plans all in between. 82 a month versus 40 cents a month. Right. I know some people, like a lot of my clients who are on that $8.30 got notice that it's going to be 40 cents. So right away they're thinking, or when somebody's new, it's like, well, what kind of plan is that for 40 cents? WellCare. But you see, WellCare, it's all these drug plans, they're subsidized by the government. You pay a certain premium, but the government pays them a lot of money every month. Now that it's 40 cents, I got to find out from some CFO of the drug or somebody in the know how much money the government gives every month. I'm guessing it's got to be a couple $100. I got to research that this year. I got to find somebody who will know that. So that's the latest on the drug plan. WellCare is a very popular drug plan this year and into next year. Several years ago, Humana used to be a real popular plan. They still have drug plans. They're okay. They're not 40 cents. They're more like $35, $50. Then United Healthcare ARP, they used to have some good drug plans. Not so much anymore. I feel really bad if someone comes in and they weren't my clients, but they're on a Blue Shield or Anthem Blue Cross drug plan. Those are really expensive. It's ridiculously expensive. They're not in the business for drug plans. They have it because they're a big insurance company and they sell a lot of supplements. That's going to be the next thing we're going to get to. Yes, that's a good comment. Right. A lot of people, as they turn 65, they may have Anthem Blue Cross or Blue Shield on their work plan. So they're going to call Anthem directly or Blue Shield and, oh, I'm going on Medicare. And they'll enroll on, they have great supplements that we're going to get into next, supplements to pay the 20%, but their drug plans are not priced right. And people don't realize they can have a separate drug plan company compared to this. You don't need the same company. You don't need the same D plan and supplement. They're two separate things. A lot of people don't realize that. So I love using, I use that Medicare.gov website all the time when people come into my office or if I talk to them on the phone. And I empower people to use that website because they'll see for themselves. It's a little convoluted how to get to search for it, but you know, if you focus on it, I can walk you through it. You can find it. And the reason why it's complicated is because the Part D program in general by Medicare is very convoluted and messy. They used to use the word donut hole. That's a term, if you're taking brand names, you know what that is. You pay your $45 for Xarelto or something, but then in October comes, and then you're not paying $45 anymore for Xarelto or some expensive drugs. You're paying $150 a month for that drug. That's because what you pay and what they pay, or what the company says Xarelto is worth, like $500, reaches $5,000. Then you're in the coverage gap where you pay 25% of the cost. So it's sudden. People, and every drug plan has that. And then if you have really expensive drugs, you'll get to the catastrophic stage. And that's where you pay 5%. Most people don't get there. But if you take a drug like Stelara, that's like a $20,000 drug. You're going to get there in March. In fact, Stelara or some really expensive drugs, you'll get there in March, maybe even February. And it's unfortunate because January and February, well, January you're paying like $2,100, and then in February you're paying $1,000, and then for the rest of the year you'd have to pay 5% of that, which is still a lot of money, $400 maybe, $500. Well, the good news is, starting next year in 2024, that catastrophic stage, you're not going to pay 5%, you're going to pay 0. So already it's been a huge relief for, I don't know, maybe 3%, 5% of Medicare people on these really expensive drugs. It's great. So already there's help. It's getting better because there's people right now paying $8,000, $9,000 a year for their drugs. So next year, because of that zero cost when you get to the catastrophic, from all the analysis that I've done, no one will be paying more than around $3,500, give or take maybe a couple $100. As of now, it's $8,000, $9,000. So help is coming next year. And then in 2025, that's when the government is putting a cap on drug costs of $2,000. So it's even going to get better in 2025. You might have heard in the news story things like referencing that. And also there is the government's going to negotiate with drug companies. They haven't done that. And that was a big concern with the public in general. Why isn't Medicare negotiating drug prices? Well, now they were going to do it, and they have 10 drugs they're going to start out with. Eliquis is one of them, and Xarelto. But it's not till 2026. But that's kind of irrelevant now that they're putting the cap on the drug costs. So the Part D drug plans can be very confusing. I can spend an hour with someone talking about their prescriptions. Because why? How come it costs that? Isn't there anything better? It goes on and on and on. It's very complicated. But that plan finder, that's what it is, and that's what I show them. Like people will say, well, why? Well, there it is. It's the government web, that's Medicare drug plans. It's an eye-opener for a lot of people going on Medicare, especially if they've had well, generally, that's one thing. If you've been on an employee group health plan, they have better drug plans than Medicare. And that's why people are shocked. So the Part D can be confusing. So now the bottom part, Medicare supplement insurance. It supplements Medicare because remember, original Medicare only covers you at 80%. You pay 20% of everything. So Medicare supplements help pay that 20%. There's a whole nother series of 10 letters for Medicare supplements, but I try to make it simple for people, and you can pretty much narrow those letters down to Plan G or high deductible G. Now, there used to be a Plan F. Some people are still on F, but if somebody has been on Medicare prior to 2020, you can still have your F plan. It's been grandfathered. But any brand new people going on Medicare after 2020, they can no longer get F. Think of F as the full plan. But the only difference between F and G is with G, you have to pay a $240 Part B deductible next year. And then it's just like F, everything's covered. But see, the F plan covers the $240. However, anybody who's on F, if you're over 68 or so, you still have F, you're paying about $50, $60 more a month for your F plan. That's $600, $700 a year premiums more just to cover a $240 deductible. So anybody who's on F should consider going on G, because you're going to save money. Sure, not thousands of dollars, but you're going to save maybe 500. But when I talk to people on F, sometimes people get stuck and they're creatures of habit and they're nervous. Well, I'm not changing. I like my F. I don't get any bills. Right, but you're paying for it. Whereas with the G, you're going to get some $240 bills. You may not get them all at once. In fact, I had one person come into my office. She was confused in July. She came with a couple of bills that she had. I didn't think of it right off the bat because there were a few of them. But then when we went on our Medicare.gov website, she had an account. She created an account. I looked at the claims because they have the claims on there. Medicare sends Medicare summary notices to people, but she didn't have them. She threw them away. But they're on the internet, and I could see. And then it dawned on me, oh, these 3 bills are added up to 240, not 240, but 226. It's this year's, but next year's 240. I said, that's your deductible. And so it was the dermatology office that she was at 3 times that didn't send her the bill until July. So she was confused. So that's why, having a deductible is not bad, but it can be confusing. How do I pay that? When do I pay that? Well, when are you going to go to the doctor's office? And some things don't have the deductible. Preventative services like mammograms, you go in for a flu shot, your annual wellness visit, that's zero, whether you have a supplement or not. So if you don't have any diagnosis problem and you're not going to the doctor until April or May, well, and you're on Plan G, well, you're going to be paying your $240 deductible. Anyway, that's G. G is the best you can get if you want complete freedom of choice to go anywhere you want and you want consistency. You're paying monthly premiums. If you're 65, well, that's 65, they give you a bonus for the first year only. That goes away fast. But if you're 66, you're paying like $160 a month. If you're 75, that turns into more like $250, a little bit less maybe. These supplements go up according to age. So that's one thing about the supplements. They go up higher and higher as you get older and older because there's more claims coming in. And so that's the worst part of supplement Plan G is the premiums. But there's relief if somebody wants to change things. They could go to high deductible G. High deductible G, it won't be 160 or 270. It'll be about $100 less. It'd be like $50 for a 65-year-old or $100 for a 75-year-old. However, it's high deductible. Now, what that means is they really shouldn't call it high deductible, but I'm going to explain why. Because your deductible is only $240. That's not a high deductible. They should call it out-of-pocket max G. Because remember, the problem with Medicare only, there's no limit to that 20%. Well, the high deductible G puts a limit, $2,800. But the deductible is only $240. That's Medicare's deductible. And then you're going to pay 20%. And then if you go in the hospital, you're going to pay $1,632. So, but people may do that because they want a lower premium. And at least there's protection, because if they ever reach $2,800 in the year, then they'll be covered for the rest of the year, 100%. Like they say, no risk, no reward. So people who are risking paying extra if they get really sick are saving premium dollars all year long, maybe about $100. So that could be $1,200 savings over a year, $2,400 over 2 years, $3,000 or $4,000 as years go on, enough to pay the $2,800. The high deductible plan is not very popular with people because it's confusing. People rather have predictability and pay the higher premium for $100 more so they don't have to worry about all those bills and what things are coming in.
My question is, how many people don't want that high deductible plan, but go to Vegas for vacation?
Well, right, that's true. I mean, it's all a matter of priorities. Well, right. I mean, that's a very good point. There's priorities people have, like don't go to Starbucks every day. And you could say that's very true. There are some lower income people who barely can afford things, and they're on G because they don't want all those bills, and consequently there is very wealthy people on G, and they could certainly go to a high deductible and possibly save money. But then again, they have a lot of money, and why not spend it on them for a good plan? But everybody's different. That's a good comment. So see, this side, original Medicare, Part D, and a supplement is the traditional way. And I say traditional because that was how it's been since Medicare came out in the 60s. So now when you hear the word Medicare Advantage, that's the other side. Now, typically the Medicare Advantage plans were associated with Medicare HMO plans. And if you don't, everybody seems to know that an HMO is restrictive. You got to have a primary doctor, and that doctor has to initiate referrals to specialists. You have to designate a specific medical group for all your routine care. The reason why people like the Medicare HMOs, it's a zero premium, and it includes a Part D plan. So they're very popular. And in this area, we have really good medical groups. That's why it's sort of conundrum for people because, well, my doctors are all on that list. Why wouldn't I join that? It's like, sure, go ahead. That's great. If you don't like it, we can switch things later. That's it. Nothing's forever. Because Torrance Memorial has a group called Torrance Memorial Independent Physicians Association. And that's a very good medical group. They have doctors on Manhattan Beach Boulevard. They're scattered around. Oh, El Segundo, they have a nice new facility. Anybody on the original side can see those doctors too. See, the HMOs have private doctors who are also see other patients, except Kaiser. Kaiser's unique. They have a Medicare Advantage HMO. And of course, if you go to Kaiser, you can only go to Kaiser. They're unique because they're the insurance company and they're the medical group. Whereas the other HMO plans, the 14 other companies that you see advertised, like Scan, Humana, Blue Shield, United Health, and plans like United Health, they have a supplement and an HMO. That's why it gets confusing. Somebody will say, well, I have Blue Shield. All right, do you have the Blue Shield HMO or are you on the supplement? I don't know. Well, okay. How much do you pay? I don't know. All right, well, let me see your card. And so the card will say, the card says, if it's an HMO, it'll say Medicare HMO on the card. So that's why there are a lot of companies and they contract with medical groups. Like, so it's different. You have the insurance company and then the medical group. Unlike Kaiser, Kaiser's the medical group and the insurance. It's all in one. But with Scan or Humana, these other companies, they contract with maybe Torrance Memorial IPA. Or if you like Little Company Mary, Little Company Mary has a medical group called Axminster Medical Group with the Providence doctors. Or you might have heard of Optum. Optum used to be called Healthcare Partners, and now it's Optum. They contract with all these plans too. So the HMOs are very popular here. I would say 50% of the people are on HMOs and 50% on the supplements. So they're great. It's just that they're good until they're not, because, you know, the typical thing is, oh, I love my plan, I don't pay anything. And then you have to have knee surgery or hip surgery and you get referred, you have to go to that one location generally, or two maybe, and you don't like that orthopedic doctor. You don't like how what they're saying, and you want to go somewhere else. You want to go to Coastal Orthopedics, which is right around here, Dr. Mueller's office. Well, not on HMO plans, so you're going to have to get out of your HMO. So that's why the HMOs are wonderful, and they all offer all these perks like glasses and dental. Don't get excited about the dental, because you have to go typically you have to go to their dentists, an HMO dental office, and people don't like them. But if somebody's got a lot of dental needs, and there is one HMO with Aetna where they're offering over $2,200 a year in dental benefits, and you can go to any dentist. It's great. And their HMO benefits are good. Now, you have to pay for it first and then submit the claim, but they refund it. So if anybody has a huge dental needs anticipating next year, that would be a good one. Every company, these HMOs have certain little things that that stick out for people that are might be good? Well, I'll get an example for you. I just went on Medicare in January. So I joined an HMO plan. I don't really see doctors that much. I mean, I saw one in the last 15 years. It's bad. I should probably go and get blood work again. But last time I did 3 years ago was good, but I'm probably about due again. So I joined Humana because Humana HMO works with Torrance Memorial Group. I like those doctors. And they give me money back to pay for my Part B premium. So I'm getting $100 a month. So my Medicare Part B premium would be like $74.70 only. Now, there's a trade-off. They're giving me the $100, but if I go to a specialist, I'm going to pay $25 for a specialist visit. I don't really think that's a problem. I'm not going to go to 4 specialists every month. The other one that throws people off, if you go in the hospital, rather than these other HMOs where they're all 0 hospital stays, I'm going to have to pay $175 each day, days 1 through 5, and then it's free. So there goes my $800. There goes my $1,200 I got that year. But I don't think I'm going to go to the hospital. I'm taking a chance on that. They do have an out-of-pocket max, $2,500, like with chemo. On all the Advantage plans, if you have chemo, you're paying 20% until you get to a max. $2,500 is a lot for people. Anyway, I went on that plan because that's good for me. So that's why when I talk to people, it depends upon what they want and what they need or how much they're willing to risk maybe, or what doctors they have. It can be a little confusing. So that's the Advantage HMO. Now there's a new thing around that's gaining very much in popularity, Medicare Advantage PPO. Because you see where over here it says Medicare Advantage HMO or PPO. Now remember, it's a PPO. It's not original Medicare. So a few companies have these Advantage PPOs out. Premiums are as low as $0 per month, like an HMO. But you have all sorts of costs that you're going to pay as you go in. There's hospital copays of $295 a day, days 1 through 4. MRI copays of $300, a lot of copays. And then if you go in network, you're going to pay that. If you go out of network, you pay even more. But people are appealing to it because, especially the older population, if you're over 75 or more, you are paying close to $300 a month for your supplement. So this PPO that's not 0, there's one by United Healthcare that's $42 a month, much better than all the others because it lowers your out-of-pocket max. They have a $2,900 out-of-pocket max, which is very good for in-network, $54 for out-of-network. So if you like Little Company Mary, that's out-of-network for whatever reason. But UCLA, Torrance, Cedars are in-network. So the Advantage PPO is gaining in popularity, but it's not predictable. It's not as predictable as your G because you're going to pay a low premium of $42 and it includes a drug plan, but there's all sorts of costs involved later on. And the reason why it works that way is because the government, on Medicare Advantage side, the government pays the insurance company every month, whether you're going or not. The HMOs get a lot of money. They get somewhere around $1,500 to $1,800 a month for each person. That's why they can offer all these 0 costs, because the insurance companies make money whether you're going or not. But that money, a large portion of that $1,500 is going to the medical group, Torrance Memorial Physicians, Providence Physicians. So they're getting a good $1,200 maybe every month, whether you're going or not. So it's as though you are earmarking some Medicare dollars to that insurance company and that medical group, and you get rewarded with really nice benefits. The downside for the HMO is, of course, you don't have that freedom of choice. So the Advantage PPO is kind of an in-between plan. It's not an HMO, but it's not a supplement. The doctors do not bill Medicare. They're going to bill the Advantage insurance company. It's not a problem with 99% of the doctors. But for example, there's one doctor, I don't know if anybody's heard of Dr. Thomas Legrelius. He's a popular concierge doctor. That's a new thing going on. That's another topic. A lot of doctors are going concierge, where they want you to pay more money every month to them, about $3,000 a year or more, and then you'll have complete access to their care, 24 hours a day, call them on the phone at 3 in the morning, or you'll have a same day appointment. They'll spend 2 hours with you. Those are concierge doctors. So Thomas Legrelius is a concierge doctor. He didn't show up as being in network for this Advantage PPO. So I was suspicious of it because he's unique. He's a concierge doctor. He's been around for years. So I called his office, and the office says, no, we won't take that Advantage PPO. So I questioned it. I said, well, okay, that means you're out of network. You'll bill United Healthcare, right? And get whatever paid. They're going to pay you Medicare rates. No, we're not going to bill United Healthcare. Okay, goodbye. And I told them, I gave them a warning. Probably one of your patients are going to come in there next year with an Advantage PPO card because it's a PPO. They can go wherever they want. And if you tell them you're not going to bill United Healthcare, they're not going to be happy. I have a feeling they're going to probably change their tune and start billing United Healthcare with a few patients who are paying $3,000 a year for the concierge practice. But so that's like a little bump in the road in the Advantage PPO. If you're going to Thomas Legrelius, you don't want that plan. And that's not common, very rare. But again, that's why original Medicare is more predictable. And the reason why the Advantage PPOs are gaining more popularity, not only they're being introduced more now, they've been around for years, but only for retirees of places where people have health insurance from where they worked. A good example is LA Unified School District. If anybody's a retiree from LA Unified School District, it was about 4 or 5 years ago, they switched them all to an Advantage PPO plan. And it's a great plan. They don't pay anything for it. A lot of zero, it's almost like an HMO. It's wonderful. They still give very good insurance, but it's an Advantage PPO. And all those LA Unified School District people, I don't hear they're having problems with that. IBM retirees, or the latest joining it is going to be Boeing. Boeing has now going to be offering a Medicare Advantage PPO next year with Aetna. And a lot of people, it just came out. A lot of Boeing retirees are calling me, oh, I don't like this. What is this? They're thinking Medicare Advantage means HMO, but no, it's a PPO. And so I got to explain that Boeing doesn't do a good job of educating the scene. This like, go online, or here's your stuff. So I'm telling them, go with that plan. And in January, February, if you have any problems, I can easily help you get some other insurance, because when someone's on an employer group health plan, they can drop it anytime they want throughout the year. And they have a special enrollment period to make a change. So see, as I said in the beginning, this open enrollment period that started October 15th and goes to December 7th is just one time frame where most people can decide to make a change. But it's not the one and only time. There's all these exceptions. So I tell people, don't wait. If you have a concern, and don't wait till the end of the year to think you have to wait to change something, because there's always things that can be done in general. I have some people thinking they can't even change their primary doctor until open enrollment. That's really ridiculous, because you can always change doctors in medical groups if you're in an HMO. So anyway, that's what the Boeing Advantage PPO is, the latest one joining those ranks of Advantage PPOs. They're just confusing the way the benefits are, but they're nice. They do have some benefits similar to the HMOs, like some dental reimbursement or eyeglasses. And all these plans, and even the supplements, most of them have the gym benefit. You might have heard of Silver Sneakers. You get a free gym membership, 24-hour fitness, LA Fitness, and there's other locations. If somebody really wants that YMCA in Sepulveda, United Healthcare HMO or their PPO or supplement offers that. There's a unique one. It's not Silver Sneakers. They call it Renew Active. So they have quite many other locations, which is kind of nice. But the gym benefit comes along with most of these plans. So that's why this is a little roadmap. And if you have an employer group retirement plan, you're somewhere on here. You're either on this side or the other side. There's some employer group retirement plans that aren't technically called Medicare supplements. They're secondary insurance, but it helps pay the 20%. Medicare supplement, or Medigap as they call it, is a term for the letters like G and F and high deductible G. But Medicare, people retire from certain companies, they don't have those letters. They just have a plan that kind of combines the D and the supplement in one, and their secondary insurance. So then the other thing is, for very low income people, that 174.70, the Part B, if someone has extremely low income, then the state of California, they'll go on Medi-Cal and the government pays that 174.70. But you really have to be very low income, barely any assets in the bank, no stock. They look at your stocks and your bonds and IRAs. So it doesn't apply to everybody. You have to have extremely low income. So everybody can sort of fit somewhere on this page. It's a matter of where do you fit and where do you want to fit, or do you like where you fit? Usually the trigger for change is money, because it's getting too expensive for the supplements. People wonder how they can make a change. Or on the HMO side, it's all of a sudden you can't see that orthopedic doctor that you thought you would be able to see. So they want to change. The Advantage PPO, it's kind of a compromise, because maybe people won't like it as they start accessing care, because they'll be paying a lot of money and they might want to have consistency with the G plan. So, but the Advantage PPO, I'd have to say that's the biggest news for this year. It started for individuals in a big way as of last January, and it's growing in traction with people spreading the word on it. It's good because it satisfies the concern that HMO people have, that they can't see their doctor, and so they pay a little bit more. And for the supplement people, it satisfies them because it lowers the premium, but then there's this unexpected cost later on. So that's it in a nutshell. You either have original Medicare and you're on that side, or you're on Medicare Advantage. And now's the time of year where most people can think about changing. And if you do it by December 7th, the new plan starts January 1. That's why there's a cutoff, because if you wait till December 7th, the companies need a couple weeks to get your new ID card out and everything. And then you have it by January. And then January through March is the Medicare Advantage open enrollment period. They don't advertise that, but it's a good rule, because if you didn't do anything and you're on your particular HMO or that Advantage PPO, and then all of a sudden you go in January and you have a big cost for a drug that you didn't have last year, or some unusual cost, well, that's why the government allows people to make one change January through March to a different Advantage HMO, or they could go back to original Medicare. Now, getting a supplement G is a little tricky. That's why on the left side, if you read about original Medicare and supplements, they'll say the best time to get a supplement is when you first go on Medicare, because you may not be able to get in the future. There's a lot of exceptions, but that time period, January through March, isn't one of those exceptions. So that's another period, January through March. And then Medicare supplements have an open enrollment. It's around your birthday month. People on Medicare supplements will get a letter saying, you are entering your annual birthday open enrollment, where you can change supplement letters without underwriting. Underwriting means health questions, and a lot of people, if they fill out health questions, they'll get denied for little things. But during your birthday, if you're on a supplement like F or G, then you can change supplements. Blue Shield of California is having what's called an underwriting holiday. It's silly, but they're accepting anybody now on who's on HMOs and the Advantage PPO starting January 1. That's unheard of. That's very unusual, because if you're on an HMO or Advantage PPO, there's no guarantee you're going to get to a supplement on January. But with Blue Shield's done it for 3 times, 3 years in a row. So like I said, there's always exceptions. That's why there's no hard, solid rule about any one thing. That's why when I hear people say, well, my friend said I had to do that, that's not true. There's exceptions. And so that's good to know. I mean, the government has to have exceptions. Right. No.
My brother just turned 65.
Right.
And whatever he did, you know, it's like, well, it looks like if you don't sign up for it when you turn 65, then there's
No.
downside.
No. No. In fact, it could do more harm than good. But what you're getting at is people say, well, sign up for A because it's free. And you have to. You don't have to. And if you do, and you happen to have a HSA qualified account through your work, you probably don't. Some people do. An HSA, health savings account, that's a high deductible plan that people have at work. Oh, all right. Then you don't want to sign up for A. Well, if you contribute money. See, because if you sign up for A, oh, okay. All right. Well, you'd be in big trouble because they're funding it. Because if you sign up for A or B or both, and you're 65 and you're on that HSA plan, you can no longer, the company would have to stop making contributions. So you would have damage done. And then if they find out you have the A, you'd have to pay a penalty and pay that money back, or the company would take it back. So you'd get really messed up. And so that's a typical thing I hear all the time. Well, only the one thing about the supplement, if you were born after 2020, you can't get Plan F. Oh, I'm sorry. If you're going to be eligible for Medicare after 2020, and you're 5 years later. Yeah, the main rule is you're not going to get F, but it's not a disappointment. G is just as good. So see, that's really important that you don't sign up for A. Right. And what I do is I send people the PDF file of the Medicare new booklet that explains that. You'd be enrolling in the future under special enrollment period, and there's no late penalty. Now, if you were to call Medicare and they don't ask the right, or Social Security, because you apply for Medicare through Social Security. If you were to call Social Security and they don't ask the right questions, they'd just enroll you in A, and then you'd have a big problem because they wouldn't go into that detail. Now, do you have an HSA? They're not going to, oh yeah, we'll sign you up for A, it's free. And then that's going to be the wrong thing to do. So that's why calling Social Security, you get different answers a lot, and it's always not can be a problem. But you enroll through Medicare through Social Security, but you don't have to worry about anything until you leave your employer group health plan. So that might be, I deal with people all the time who are 70, 75. As a matter of fact, I had an all-time winner who was going on A and B of Medicare for the very first time when they were 81 or 82 years old. Because that's something, she was working as a teacher at the California Fashion, it's downtown LA, and she's just going on Medicare for the first time. So that was pretty interesting. So any other questions maybe? We'll open, because I pretty much covered it all. If there's any other questions, I can answer anything. Yeah. Oh, over there you have a question. Right.
I was still on my American health plan at my employer health plan. But because I didn't sign up for Part B, I thought I didn't have to. Now they're saying I'm going to get penalized 10%.
No, but you're on an employer group health plan, right?
I was until May of 2022. And then
we have 8 months after the employer. So June, July, August, October, November, December, January. Oh, it's with, oh wait, it's 2023 now. Okay, but wait a minute. Why, so what type of insurance do you have now?
Well, now,
yeah,
I kind of don't. I mean, I have Part A, that's all. So I went to the office to sign up, and they're like, oh, we can't sign you up now because
you weren't on an employer group health plan.
Yes, till May. I thought
that was a year ago, a year and a half ago.
May of 22 it ended, and then I mean my employment ended May of 22. They covered me until November of 23.
Oh, so your employer covered you until November.
Yeah,
all right.
And so I thought I was covered longer. I kind of.
Well, your employer, they should have immediately notified you. So it's their fault. your employer. They kept you on a retirement. I mean, you were retired.
Yes, because we got furloughed. So we were able to keep our health benefits at American Airlines until they said 36 months.
But technically, you're not working. You're
Right.
retired.
Technically, I wasn't working, but I was getting paid.
Well, I can tell you, there's special circumstances that Social Security didn't tell you, where they can enroll you earlier. There's a certain form, rather than waiting till January, because they said you have to wait till
Yes,
January.
so come back January 2nd.
Yeah. Well, there's a form I can email you. It's under special circumstances because you were misinformed. Your insurance that American gave you should immediately red flagged it, showing that you were over 65, and they should have kicked you off the plan because you should go on Medicare. So they neglected that, and
Yeah.
because of that reason, they'll very likely enroll you, because I've had that situation happen to somebody.
Okay.
So call
Thank
me
you. Okay.
or send me an email.
Thank you so much.
And then,
Okay.
then that way you can get Medicare sooner, and you're not going to have a late penalty.
I've been losing sleep over it.
Yeah, I bet. Well, I'll tell you what, that you're not unusual. That people do make mistakes like that, and I help them out a lot. Generally, there's a handful of people a year that happens to. But yours is really blatantly neglect by that American Airlines insurance. Is it Anthem or Blue Cross Blue Shield of
Cross, yeah.
Texas? Yeah.
Yeah, Texas.
Right. Oh yeah.
Yeah.
Call me. You should be all right. And
Really?
because the late penalty she was talking about is 10% for every 12 months that go by. So what that means is you would have, well, that'd be 10% because only one full 12 months would go by. But that's 10% of this 174. That's an extra $17 for the rest of your life tacked on. And plus that, well, you do have insurance. Well, you don't have insurance in December, right? Because, yeah, so that's a problem. And no, you know what, about Covered California, you'd have a problem because you have Part A. Because if you go in Covered California, they say if you have A or B or both, you can't get Covered California. But I'll help you with that. That's good that you're here. That's going to be helpful. That's about it, maybe?
No, hold
Yeah.
on.
You just said something which kind of rang a bell with my brother figuring out what he was doing last year. So if you don't sign up in a certain time frame, then you get this additional penalty for
Right.
the rest of your life.
Right.
What's the rule about that? I don't.
Well, if you don't
'Cause
have
that's-
it,
I thought that was the thing. Like, oh, you got to do it when you're 65
No.
or else. Something.
unless you're covered under employer group health plan through active work. See, she wasn't actively working. She was retired. You have to be actively working. So what's going to happen, like when you do retire, maybe in 3 years after you're 65, there's an employment verification form. The Social Security gives it to you. You'd give it to your employer. A company official signs it, like an HR person, and they check off the boxes. And that's proof. That's the only proof that the government needs to show that you were covered under employer group health plan as an active employee, and they won't penalize you. And they'll ask you, when do you want your Medicare to start? January, February, March? That they coordinate whenever your plan is ending at work.
So you do that each year?
No, it's just when you
Just
finally retire.
The year you're going to retire.
Yeah, exactly. Yeah.
Got it.
But your but that's the confusion. Well, you got to do this, otherwise you're going to get a late penalty. Well, not if you're currently working and you're covered under the employer work plan, or your spouse is. So there's many spouses that are working, and the other spouses on the plan, and they're 68, but they're not on Medicare because they're on their spouse's employer plan.
Got it.
So yeah, and like I said, I'd email you the booklet where it shows in black and white, printed by the government, and I deal with this all the time, so I know what I'm doing with this. Your case is very unique, and it's too bad. Well, we'll talk about yours. There's this other form that is good, that should work. And then this time of year, I'm really busy. so you can hardly get me on the phone. But if you send me an email, that'd be helpful. Yeah, because then I'll send you the form and I can explain what to do. And then eventually, when you do get the A and B, American doesn't give you any retirement. Are they giving you some sort of retirement plan when you go on Medicare? Probably not. I don't think so. Yeah, they don't do that. Yeah, yeah. So then I can help you with the extra, whatever it might be. Yeah, but first you need to get that A and B. Yeah, the B, because you have A, right? Yeah, so it's adding the B, right?
So just one question, as far as, this whole enrollment period now, so does that just really apply to people who are on the HMO plans, the Advantage plans, and then the people that are on the supplement on the other side, they have to do it at their birthday?
Well, that's a good point. Right, this Medicare open enrollment is really all about Advantage plans or standalone drug plans. It's not about supplements. So yes, that's a very good point. A lot of people think they're on a supplement. Well, a lot of people on supplements end up going to the Advantage side. So they can do that during this time. But if someone's completely happy on the supplement plan G or whatever letter they have, that's not what this year's all about. They can't change their supplement. It's around their birthday. That's very true. Yeah, the government should sort of maybe put that together somehow. But the reason why they didn't is because supplements were around a lot longer than the Advantage plans. And they just never, there's some rules and things published with Medicare that are kind of outdated. Like if you only have original Medicare, or when you look at original Medicare, they'll only cover you for 60 days in the hospital, and then you have 90 days lifetime reserve. Well, it's kind of really old because, yeah, maybe back in the 60s and early 70s, people spent weeks and months in the hospital, but no more. People are in the hospital and then they're discharged in a few weeks, a few days, and there's more appropriate care, like a skilled nursing facility that Medicare covers, or there's home health care. And the technology has improved so much where there's, that surgery where they don't even cut you open. So it's not like, there's some things with Medicare that probably should be revised.
Hold on.
If you don't do anything, if you don't do anything, are you automatically re-enrolled?
Right. Yeah,
everything?
you don't need to do anything. Whatever you have now just rolls over into next year. And I forget what you have, but you can tell me later.
I was updating my prescriptions. I'm with WellCare.
Oh, yeah.
And
You're with the one that's going to 40 cents probably, I think. Is it $8.40 now a month?
Well, I didn't see that, but I just was updating
Yeah.
my prescriptions. And then when I finished, it said, okay, sign up. It said,
No.
and I didn't push the button, but it was to re-sign.
No, you don't re-sign.
Okay.
Did you log on to your site, your own Medicare.gov site?
Yeah, I think so, yeah. Well, I logged on to the WellCare site.
Oh, well, that's not a good idea because did you log on as a member?
Yeah, yeah.
Well, you don't have to re-sign up. No, I don't know what you were looking at. You don't have to re-sign up unless you change to a different WellCare plan. They have 3 drug plans.
No, I didn't, or I wasn't.
Yeah, you're probably okay.
All
But
right.
you for the best information, you'd want to go to Medicare.gov because not only will it have the WellCare drug plans there, but it'll have the 19 other drug plans.
Oh, okay.
But chances are, I have a feeling you're on, I could see one of your card. I have a feeling you're on the $8.30 a month premium WellCare plan.
I think so.
Right. And that's probably going to be the best plan for next year. For most people, it is, unless you've taken some other really expensive drugs. And I can help you with that.
Okay.
We can talk more, but you're probably okay.
Because most everything was zero.
Oh, then you're taking generics. Unless you pay $15, that's a tier 2 generic for 90.
There was one that was $15.
All right. Okay, so you're not paying like 45, 100. Okay, you're on the good drug plan still then.
Okay.
Thanks.
Any other questions? How about on
All right.
Zoom? Can you see the file I put in? Oh,
That's Rebecca.
Becky, you got
I know
anything,
Rebecca.
Pat? Any questions?
Well, it's fun to come here every year. Makes me realize how fast the years go by. When there's certain yearly things, right? It's like,
That's
wow, it's
right.
Christmas again.
I know.
Oh, it's 4th of July again.
Yeah.
I know. Yeah, that's true.
Yeah.
Well, yeah, I always say old age is 10 years older than you really are,
Yeah.
right? So even if you're 94, well, that's not so old. 104 is old. And you're 104, well, that's not so old. 114 is old.
Okay. Well, thank you so much,
All
Vince.
right,
We really
thanks very
appreciate
much.
your coming.
Yeah, very good.
So next week we're going to be going over, I know we've covered the topic of gratitude before, but I think it gives us a good opportunity to think about our blessings and just the many things that are out there that we should be grateful for. And I think what other people are grateful for, I may not be thinking of. So I think it'll give us a great chance to just discuss, get to know each other a little bit better, and really to have a positive thing. There's so much negative going on, to have a positive thing. So that's next week. Hope to see you. Have a great week.